So what you're saying is that biological medicine that you discovered and got trained in Germany gives
Yeah.
you a viewfinder, another understanding or reading or mapping of the internal workings of our bodies, enabling us to understand the root causes that enable for a pathogen to thrive, what we then call a disease. In other words, understanding that internal terrain, which you could not find with either conventional medicine or naturopathic medicine. Is that correct?
And that's it. That's it exactly. And so finding a different mechanism of approach, a framework of thinking to be able to look at the body from a slightly different perspective and diving in so we could figure out how the body
A
works.
patient walks in, I walk into your office in Toronto, how would it
Yeah.
work, practically speaking? So you're a biological medicine specialist who has a naturopathic and holistic outlook on health of his patients or her patients. How would you address me or anyone walking in? What does it look like exactly? What do you do? What biological specimens do you take or not? Just guide us through the journey, please.
Sure. If I may, I want to take just a slight step back, and I'm so thrilled about that question, and I will pin in for a second because I want to answer that. But let's say, for example, I punch you really, really hard, and I knock you down, and you get back up, and you either don't ask me why I punched you, run away, or defend yourself. There's something wrong. There's a miscommunication in your body. Let's say I punch you a second time, I knock you back down, you stand right back up, and you do the same, which means nothing. There is a blockage in your body from responding. If I do it a third time and your body still doesn't respond, then you are rigid, your body's stuck. If I give a patient who is stuck a whole bunch of supplements, a whole bunch of remedies, a whole bunch of IVs, are they going to respond? No, they won't. They are physiologically stuck. So part of biological medicine is to recognize what aspect, where is the patient in their level of stuckness, if you will, in their level of blockage, in their level of rigidity, in order for me to enable a mechanism of treatment. It's not just, here's some blood tests, now I treat.
Are you telling me that, and telling us that patients have different degrees of blockages in the body on a physiological level, or are you talking about trauma, which then manifests in physiology? So you're saying the biological medicine is able to identify the different, where the different blockages are seated and located, or are we talking about physiology only?
No, we're talking well beyond just physiology. I think that's one of the gifts that biological medicine has to offer. There are always, we double our knowledge in science every 5 years. There's always new innovative techniques and technologies that we can utilize from around the world to enable us as practitioners to be able to assess our patients, to then determine the intensity of how we treat. Not everybody that has Lyme disease goes in for IV therapies, at high doses antibiotics or nutraceuticals.
Okay, so Dr. Dhanani, a patient like myself walks in and doesn't really tell you why he's there. Just, I want to build health.
Yeah.
I don't give you too much
Yeah.
information. I let you be the detective. Take me through the journey, please.
It's the most fun you could possibly imagine, because I don't, as terrible as this sounds, and I apologize in advance, I don't like to look at my patient's file before I look at the results. I want to put together a framework of how to treat patients before they tell me what their quote unquote clinical medical disease process is. So patients come into the office, I starve them, I dehydrate them, I get their first morning urine sample, I get their saliva sample, I run them through a variety of different diagnostics in order for me to determine where their terrain sits. Part of those diagnostics are things like HRV. We've got two very, very interesting HRV systems. We look at what's called a dark field analysis.
What is a dark field analysis? Could you please?
A dark field analysis is taking a drop of blood from a patient and looking it under a fancy microscope that expands and magnifies their picture to over 1,500 times.
The question, Dr. Dhanani, isn't that similar to what conventional doctors study, or naturopaths at naturopathic college or medical school? How different is this microscope and this understanding of that drop of blood? Could you please?
Yeah, of course. So what they are looking at is they are looking at hemoglobin, they're looking at iron, they're looking at maybe red blood cell differentiation with, maybe they're looking at the number of white blood cells, red blood cells, if your thyroid is within range. And of course, those ranges are huge. We want to be more efficient and more effective in certain aspects. The dark field analysis is very
How?
different. We're looking at, if you imagine a red blood cell and its environment around it, we're looking at the terrain that is enabling that red blood cell to grow and to evolve and to live to its fullest extent. We are also looking at white blood cells. We are also looking at what is the medium of which the red blood cells and white blood cells are living within. Because if we look at the terrain, there is all of our biochemical reactions, all of our hormones, all of our enzymatic processes, all of those things have to happen in the terrain. They have to traverse through the terrain to the red blood cells, to the white blood cells, and to the tissues, of course. But it happens through that medium.
So, Dr. Dhanani, you're saying, I mean, we know that medicine is an art. We know that it's not black or white. We know that it requires
Yeah.
a mixture and a blend of artistry and scientism. But the question here is, how can this be taught? In other words, is there a system? Is this something which is repeatable, that can be duplicated? Or does every practitioner see whatever he or she wants to see? Because at the end of the day, patients don't know. So they're facing a screen and they're listening to a practitioner such as yourself interpret whatever he or she sees. Or is there a system and a rigor to the madness, if I may say so? Is,
Yeah.
is there a method in the madness?
I think with anything, and this is sometimes some of the concerns that we have with some of these diagnostic tools that are used around the world and that are used in various fields of medicine. It is really truly the education and interpretation of that practitioner. Because the patients are kind enough, and we are honored, I am certainly honored, to be able to receive their health. They are gifting it to us. And I take that very seriously. And so we have a very intense rigor. I was trained by the Pleomorphic Institute in Munich, Germany, where they have a very specific mechanism of how to assess the patient. It took them hours to teach us how to just take a drop of blood, so that we take that blood, we place it on the slide, so that we're not causing any damage, we're not doing breakdown, we're not looking at anything that we're not supposed to be looking at in the blood. The example that I typically give patients, and this is a very apropos for this conversation, is it's the only example that I have, so I apologize if it sounds very rudimentary, but you have a goldfish bowl with a healthy goldfish swimming around in here. You have another healthy goldfish, you have another goldfish bowl with very unhealthy water. I take that goldfish and I put it into here. That goldfish is going to die. If before it dies, I take it from here and I put it right back into here, it'll survive. The survival of the goldfish has nothing to do with the goldfish. It has everything to do with where's the goldfish living.
So, in your experience as a clinician, when patients walk into your office and visualize the inner workings of their terrain, is it easier? I mean, there's an element of fear, I imagine. You have to choose the right words to share the message and the picture of what you see.
Of course.
How compliant are patients, or do patients become once they see that terrain? Are they then willing to make practical changes to their lifestyle? Because as we know, many people, unless they're very ill, are really truly ready to make the shifts needed to be able to thrive.
Yeah, I think one of the positives is that it's not just one diagnostic tool that I have. I have multiple diagnostic tools. And so we bring things together as a beautiful symphony to be able to recognize where the patient sits and the process of how to get them to the next stage. However, in all of my various diagnostic tools, I've not found anything that is more, that drives the patient more to change than is a dark field microscope. Because they're now looking at their own blood facing them. And they have no choice but to come face to face with their processes.
Interesting. And how often do you see patients to monitor? Because blood fluctuates, blood changes. Do they need to come every 2 or 3 weeks, every month? Are they asking to see what's happening? Because I imagine that they start making changes. And how often do they, how do you manage their expectations, and how do you manage their quest or thirst for more knowledge?
Yeah, of course. And so we can determine how quickly or how much a patient is going to react, how sensitive they are. And so if patients are, again, sensitive based on their own terrain, based on their environment, based on their very subjective techniques, we're able to determine, I need to make a very small change, just give everybody a little bit of a push, and then I'll see you back here in 2 weeks. Some patients, we can give them quite a big push, and we look for, you start a snowball, you see how it falls down that hill. We catch them to see how big that snowball is, how much of a change that they have made, both in lifestyle as well as supplementation, can have that impact. And it would be 2 months later, maybe even 3 months later.